Thank you, Dr. Anurag, for kind introduction. And I thank you me office bearers to for inviting me for this talk. In fact, when I started reading about it, I realized that we do read a lot about diagnosis, about new markers, but we go into don't go into our in the pathogenesis. So very fast, and then 10 minutes talking about pathogenesis. So in this 10 minutes, I will try to review what is known, the information available. I'm going to cover the information that is available on the pathogenesis of lung carcinoma metastasis to brain, on the concept of seed and soil theory, that is, soil is the brain parenchyma and seed are the cancer cells of the lung carcinoma. So, as we all know that the brain metastasis is most common intracranial neoplasm, and lung carcinoma is one of the most common tumor to metastasize to brain. And in the recent times, advances in the molecular profiling of lung cancer has resulted in many novel therapies and immune checkpoint inhibitors, which has really helped in the treatment of lung cancer. But the same treatment which has helped in the treatment of the primary has not been so successful in the brain metastasis. So how does the cells metastasize? Just to simply put it in these few steps, the tumor cells have to invade the lung parenchyma, have to find a way into the bloodstream, survive in the circulation, and then extravasate in the brain parenchyma and colonize and grow. Once it extravasates, first thing it has to do is to cross the blood-brain barrier. And these are some of the fates that the tumor cells have to meet once it is out in the brain parenchyma, and we will review these different events in the next 10 minutes. So the first thing that the tumor cell has to do is to cross the blood-brain barrier. It involves many mediators which help them to break this defense mechanism. And one such mediator is cathepsin S, which helps the tumor cells to transmigrate through the blood-brain barrier. And this might be a potential target for treatment. Another such mediator is the placental growth factor, important in small cell lung cancer metastasis. Those patients who have high level of PLGF shows higher incidence of brain metastasis, and downregulation of PLGF helps suppress the existing small cell lung cancer metastasis. So this possibly could also be a therapeutic target, and I think there are attempts made in this direction. So once the tumor cell enter the brain parenchyma, after they extravasate, most metastatic cells die, and then because of the many defense mechanisms that the brain parenchyma has, and they kill these invading cells. But the one such defense is the production of plasmin from the reactive brain stroma. But tumor cells find a way to break through these defenses. And in case of plasmin, the tumor cells produce plasminogen activation inhibitors, the SERPINs, which stops the production of plasmin and help the tumor cells to invade the parenchyma. So once the tumor cell enter the parenchyma, they have to find nutrition and oxygen. For that they need vasculature. And the incorporation vasculature by the tumor is done by, these are two different processes, and these are very organ specific and entity specific. So vascular cooption is when the tumor, pre-existing blood vessels are incorporated by the tumor for growth and extracting oxygen and nutrients. This is different than angiogenesis. Angiogenesis is when the tumor cells, there is new angiogenesis, new blood vessels are formed, and the anti-angiogenetic therapy is effective where angiogenesis is predominant, and where vascular cooption is important, is a predominant process, the anti-angiogenetic therapy is ineffective. So two ways the blood vessels are incorporated, the vascular cooption and angiogenesis. In this article, state-of-the-art article by Frank Winkler, entitled Hostile Takeover, How Tumors Hijack the Pre-Existing Vascular Environment to Thrive, is very interesting to read. So it is not only the blood vessel incorporation, but the area around the blood vessel that is called the perivascular niche, very important for the tumor survival, for dormancy, and for tumor immune escape process. So the tumor cells, so as to survive, has to remain in touch with the endothelium, and those tumor cells which do lose this touch die. And in this area, this is very rich in many kind of growth factors and angiogenetic factors. And this area, the tumor cells may survive for many years, lay dormant, and whenever the opportunity arises, they grow and form a metastasis even after years of presentation of the primary tumor. Then very interesting characteristic of this area is called stemness. Stemness means this area is rich in stem cells. And the tumor cells in this area acquire the characteristic of a stem cell. Stem cells means they have a proper, they acquire self-renewal characteristic and proliferative properties, and differentiation into further types of tumor cells. And not only the tumor cells, and not only the lung carcinoma tumor cells acquire this stem cell-like quality, but glioma cells and medulloblastoma, all these tumors in this area can acquire this property. And not only tumors, but normally also, especially like in bone marrow, this area is rich in the hematopoietic stem cells and other type of stem cells also. Another characteristic of this area is that the immune cells which are present in this area help the tumor to immunomodulate and escape the immune system and develop therapy resistance. And so this area is very important for the tumor growth and forming into a macroscopic tumor. So dormancy, stemness, immune escape, and therapy resistance are helped by this microenvironment of a perivascular niche. Coming to the seed that is present in the brain metastasis is very different genomically and molecularly from the primary tumor, which as a result, they are not treatable by the same target therapies which were helpful in the treatment of the primary tumor. And this genomically and molecularly different tumor cells have been demonstrated in the liquid biopsies, and numerous papers and many types of differences have been very clearly documented in the tumor cells present in the brain metastasis. And we need to target those different molecular and genomic targets other than the what was seen in the one can see in the primary tumor. So we know that the brain microenvironment help the cancer cell for survival and for growth. And now the recent thought is that instead of treating only the cancer cell, we must treat the we treat the this cancer cell brain microenvironment interaction as a target. One such target is the the carcinoma astrocyte gap junctions. It has been seen in breast cancer and in lung cancer that the cancer cells produce protocadherin 7, which results in the formation of carcinoma astrocyte gap junctions, which results in cancer cells sending cGMP to the astrocytes, which activates the STING pathway, which in turn results in production of interferon and tumor necrosis factor, which activates the STAT1 and NF-kappa B pathways. This pathway helps in tumor growth and chemoresistance. And this paracrine loop is experimentally shown to be inhibited by the pharmacological agents meclofenamate and tonabacate, and this has been shown to have helped in the treatment of existing established metastasis of lung carcinoma. Another such axis is the endothelin axis, which is a bidirectional signaling between astrocytes and cancer cells. And upregulation of this endothelin axis protects the cancer cells from the cytotoxicity of the chemotherapeutic drugs. So these interactions can allow metastatic cells to detoxify themselves from the stress accumulation of many toxic metabolites generated by various stresses, including the chemotherapy. And a combination of blood-brain barrier permeable drugs targeting gap junction has recently supported the potential targeting interactions with microenvironment. So the recent what is going on now is, instead of targeting the cancer cell, target this interaction between the cancer cell and the microenvironment. So this is what is I could find out in about the soil and the seed. And what it is to be said is that treat the seed as well as the soil for a better preventive strategy of metastasis.